Hi, I'm Dr. Drfairoz, and I'm going to be answering some questions presented to me recently by a patient. This patient had lower back pain that started about a year ago, and he first noticed it when he was putting on his left sock in the standing position. It was central low back pain that persisted for a while, and eventually he ended up having to schedule an appointment with his family physician. The family physician ordered a radiograph of the lumbar spine, which was positive for a bilateral L5 pars interarticularis fracture. So I'm just going to go over what a pars interarticularis fracture is, and then I'm going to go over the questions that this patient was asking me. So this is a picture of a top-down view of a typical vertebral segment. This is the anterior portion, or the front, and this is the posterior portion, or the back of our body, the front of our body. This portion here is called the vertebral body. These two portions here that look like wings are called transverse processes. And this portion here sticking out in the back is called the spinous process. This here is the central foramen, which our spinal cord runs through. And these two sections here are known as the pars interarticularis. So this particular patient had a fracture in both sections of the pars interarticularis. You can have it on one side, but he had it in both. The red line is indicating where the split occurred in the vertebral segment. So the first question this patient asked was, how exactly is this treated by a physical therapist? So we treat pars interarticularis fractures by doing stabilization training. If the patient is not in a lot of pain and the segment is relatively stable, which we can assess by doing specific physical examination tests, then we do stabilization training without a brace or support. However, if we find that the segment is unstable, and or the patient is experiencing a lot of pain and is unable to tolerate stabilization exercises without pain, then we do them with a brace. The other question that my patient asked me was, can this heal on its own? And the answer is yes. As long as this portion here stays connected to the spinous process and doesn't become dislodged and start drifting forward, as is indicated by this blue marker here, and this arrow, then it can heal on its own. However, if this section that's portioned off starts to drift forward and starts migrating away from the spinous process, then the likelihood of it healing becomes low because the two bony portions are no longer connected. So the calcification cannot occur because there's no connection. The other question that my patient asked in this regard was, if it does not heal and that section does drift forward, what are the future ramifications of this for me? So if a patient has that drifting forward, but that fractured portion is stable, then the person can go their entire life and live a very functional life and even participate in some athletic activities, lift weights, etc., without any problem. It just depends to what degree that portion has drifted forward. If it goes too far forward, it can start compressing the spinal cord that runs through here, and it can also start compressing important neurological structures in the front. For example, it can start causing bladder symptoms, etc. So it just depends to what degree that portion drifts forward, if there is non-healing. Another question that the patient asked me was, is it possible to get the anterior portion that's drifting forward to pull back with stabilization training? And the answer to that is only if the fracture is very mild. But if it's a significant fracture on one or both sides and there is drifting, then it becomes less and less likely for the anterior portion that's dislodged to get pulled back. If it is a mild fracture, what's more likely to pull it back, more so than stabilization training, is repeated movement exercises where we go into flexion, where we bend the spine forward repeatedly and in a sustained manner to end range in various positions, standing, sitting, supine, or on your back. And what that does is it creates a counter force to that portion that's getting pushed forward, and it kind of traps it and pulls it back, creating a posterior or backwards force vector. The last question that my patient asked me in this regard was, should I request a repeat radiograph or x-ray from my physician? And the answer is yes. I recommend patients with pars interarticularis fractures to have physical therapy for about 8 weeks, and then after that, request a repeat radiograph to see if there's any change in the position of the anterior portion, if it's drifted forward, or if it hasn't drifted forward, to see if there's any healing at the pars interarticularis fracture site.